Hi everyone, Alexandra here with MDPen. Thank you for tuning in. Today I wanted to talk about different treatment options that exist for surgical scars and talk about scar revisions, which can be anything from non-invasive to surgical. And when we think of scars, of course, this falls into a huge category, especially when it pertains to microneedling. So there's things like severe acne scars, stretch marks, surgical scars, scars that could be like from an accident. And then you have different types of atrophic scars. I did do the LinkedIn series last month talking about the most common three types of atrophic acne scars. So you can definitely check that out. And then, of course, I did focus on the types of scars that we cannot treat and should not treat with microneedling, which are going to be keloid scars and hypertrophic scars. Feel free to ask questions. So yeah, let's go ahead and get started. So when it comes to scars and microneedling, you always want to wait a minimum of 6 months before treating a scar. And when you go to treat a scar, you want it to be a well-healed scar. And some of the things that can make a well-healed scar doesn't necessarily have to be the best looking scar, but you want it to not be a keloid scar and not be a hypertrophic scar. If you're again more interested in what those are, you can go back and watch those videos. But I know a lot of you are watching as potential clients or patients. But if you are a professional and want to know more, you can definitely go check that out that way. Another thing that's good to do too is just get your surgeon's permission to have the scar treated. Typically, there's follow-ups, after a surgical scar, whatever type of surgery it may be. Just get there okay. Of course, one other big rule is you want patients to be off Accutane for a year. And again, I would get permission from the dermatologist that was treating with the Accutane, get the okay for them to be treated with perhaps RF microneedling or regular microneedling. So I do see some questions rolling in. I definitely want to answer them. Hi, Alex. What are the most common surgical scar treatments and how effective are they? Yeah, so we're going to definitely get into that with today's video. Hi, Alex. Can surgical scar revision surgery be performed on any type of scar? So I'm not the all-knowing physician here. I'm an esthetician, but a doctor will decide. And in some cases, re-excisions can be done. And this is just kind of, starting from scratch. It really depends on the size of the scar, but you will see this done sometimes in cases of hypertrophic scars or scars that just have not healed well, where there is hope that if you were to re-excise it, perhaps even suture it a different way. Sometimes sutures can be done in places like the ER where they're just, working in that real fast emergency situation and you're not getting that nice plastic surgery, one underlying stitch closure. So something like we used to call them like railroad track marks. That type of scar could be re-excised with that one nice underlying suture, and you would get a much better outcome. But that's totally up to the doctor when, a scar should be re-excised. But that's definitely one way to go about it. I see a question about skincare. What skincare products can I use to lessen or remove my scars? Yeah, so let's talk about this real quick. So oftentimes the surgeon will have favorites. There's all kinds of different scar gels out there. There's silicone scar sheets. As far as MDPen, once your sutures are removed and you get the okay to start using other things, you could definitely utilize our human-derived growth factor gel to help with your scar healing. If you do have a keloid or hypertrophic scar, you would not use this. But if you're someone who scars normally or wants to prevent and have the best looking scar possible, this human-derived growth factor gel can be used. This is also really nice if you've been told to massage your scars. You could definitely use this in the evening and just do like a really nice massage and kind of break up the scar tissue there and use the human-derived growth factor gel. Another thing that's huge with scars is not only, of course, sun protection, UVA, UVB, but also keeping your scar the right color. You don't want to be out, having your scar, you don't want it to be tanned, sunburn, getting sun, nothing like that. So you've got to be using a sunscreen on your scars, especially your sun exposed scars. Of course, if you're going to be in the sun long term, you need something more than this broad spectrum SPF 30, but this is a great daily sunscreen. And it has a really nice lotion consistency. If you are using it on the body, it's really easy to use as well, depending on where your scar is. So those are things I'm also going to recommend. I do want to get back here to common types of treatments. So getting back into pigmentation, some scars can heal with a lot of erythema. So they can be really pink for a long period of time, not really matching the rest of the skin. And depending on your skin type and what the professional wants to do, in some cases you can do like IPL, pulse light to help with the pigmentation of the scar. Also, sometimes fractional lasers can be chosen, sometimes even CO2. Now, of course, with MDPen, one great effective way to treat your scar 6 months out is going to be that middle handpiece there, the RF microneedling handpiece. And this is really going to help with the texture of the scar, the size of the scar. It can help break up the pigmentation as well. This is always done as a series, just as you would the face or another treatment area. So you do want to have them at 4 weeks apart, and you would need a session of at least 3 with that middle intensive handpiece for RF microneedling. When it comes to treating scars, I see a relevant question here. Good day, Alex. How long does it take to see improvement in the appearance of surgical scars with various treatments? So this depends on the individual. It depends on the scar. It depends on your age, how quickly you're producing new collagen. It depends on what you're using at home. Make sure you're babying your scar or taking really good care of your scar. I would say with needling, maybe going into that second treatment, you're starting to see some changes. Keep in mind that if your provider uses PRP, they may be recommending that with your scar treatment, and that could also be very beneficial. So be on the lookout for that as well, adding PRP to it. Here's a link, guys, for those products I did mention, the human derived growth factor gel, and then also the SPF 30. Definitely want to keep your scar protected. Thank you guys so much for your participation today. So yeah, the real big things for treating scars can typically, fall into a microneedling category, which can be RF or regular microneedling, a laser category, which could be, anything from IPL to fractional to CO2. And then yes, your full-blown scar revision, cutting out that scar that did not heal well and doing a new scar revision there. Now, keep in mind, again, acne scars and stretch marks can also fall into this category. So these are also other treatment methods. Another thing you can do after 6 months is use a vitamin A or retin-A on your scar. Of course, with MDPen, we have the Radiant Retinol 1%. This is especially, it can be good in the case of stretch marks, using a vitamin A product on your stretch marks. So you guys could also, try that. If you don't have the prescription, you can always try the Radiant Retinol 1% on your scars that way. I hope this video has been helpful, guys. I know scars can be tricky. There's help out there. There's amazing before and afters from the NDMed device if you are interested in those. If you're interested in finding a practitioner in your area, you can definitely go to our website. There's a link, find your practitioner and find someone that you can consult with about treating your scars, because there's definitely ways you can get, sometimes up 65, 70% improvement when it comes to a scar. And of course, well-healed scars will be much easier to treat. If you are a practitioner who wants to learn more about techniques for treating scars, we offer training classes with MDPen. We have virtual training as well as in person, where you can really get that hands-on experience with treating scars, because the technique can be different, of course, from treating something like anti-aging or fine lines on the face. So it can really help you to have that hands-on training, especially if you're going to be in an environment where you see scars being, a primary thing for what you may be treating in your practice. It may be worth it to you, to get that extra training, that extra knowledge when it comes to scars, because they really can be their own category. So thank you guys again so much, and I will see you guys next week. Bye.